to provide for the behavioral health needs that we have. I understand that for purposes of the committee, it's good to give us a broad overview. But my question is this. We have several state psychiatric hospitals across the state. One of those is in my district, Broughton Hospital. We spent millions of dollars, and we took extra years to build the new hospital just to be sure it was right. And unless my information is outdated, we have multiple beds that are empty because we don't have staffing. We don't have a forensic unit there that I think was intended because of staffing issues. So it seems to me it's one thing to approach things generally statewide, but it seems to me that we ought to worry about staffing the empty beds we've got, maybe even before we worry about creating more beds. Unless I'm mistaken, Mecklenburg County and Buncombe, which were on your list as being high areas of people in the ED, those are in the Broughton catchment area. So is there a specific plan to address that issue at that hospital and at the others, or is it just part of an overall, we're going to throw money at stuff until we hopefully see a change?
Good question, Representative Blackwell. Director Crosby, you're recognized.
Thank you, sir. And I actually, that's a fantastic question. And I know that Chief Deputy Secretary Benton is actually going to speak to some of that. So may I defer to him?
You may. Secretary Benton, you're recognized, sir.
Thank you, Mr. Chairman. Mark Benton, Department of Health and Human Services. Representative Blackwell, thank you for your comment and question. I could not agree more that we need to do many more things so that we can hire staff so that the current roughly 100 empty beds at Broughton Hospital are appropriately staffed so that we can admit individuals and hopefully get to a point that we no longer have a waiting list. Your point, I appreciate your point very much about a lot of what Director Crosby talked about with investments in our behavioral health, urgent care, our facility-based crisis. The difference between funding staff and funding and providing some startup funds for these centers is the source of funding. I need recurring dollars to be able to hire staff, whereas Director Crosby is leveraging much of the one-time money that this body was so incredibly generous to appropriate and is using that for sort of a one-time purpose. And as she noted, and as you will likely hear in our Medicaid presentation this afternoon, one of the other things that you did was put $220 million in recurring dollars so that we can increase the behavioral health rates. So Director Crosby is going to help get the facilities opened, and we've got the behavioral health rates increased so that they have a line of revenue for that. Thank you, sir.
Thank you. We have 2 minutes, so just so the staff will know, you're never safe if you leave the staff. So I met Matt Gross about 10 years ago. Why he was on staff, the secretary and I agreed it wouldn't be good to share this. He was on a talk show, Senator Heiss, with an Englishman and a guy from Texas, and they were down to the final question. You fill in the word and spell the word. And so he asked the Englishman who had $12,000, he was leading, said, fill in the word and be precise and spell the word. He said, Old MacDonald had a, and the Englishman said he had an estate, E-S-T-A-T-E, and the buzzer went off, and Mr. Gross was really getting excited now. He was getting animated, but the Texan was ahead of him with $11,000, and he said, fill in the word and think carefully about your answer. Old MacDonald had a, and the Texan said, he had a ranch, R-A-N-C-H. And by now, Mr. Gross was just, couldn't be contained. So he said, okay, Matt Gross, now think carefully. You're the only one left. Fill in the word and spell the word. He said, think carefully, because Matt was getting up close to his mic. He said, Old MacDonald had a, he said, he had a farm, E-I-E-I-O. Sorry, Matt. You can see me in my office after the meeting. This time, we're going to discuss state facility staffing with Chief Deputy Secretary Mark Benton. You're recognized, sir.
Hey, thank you, Mr. Chairman, and I promise to keep this brief. As I start on these slides, I want to let the members of the committee know that on the row behind me, and would be the young lady who is raising her hand is Robin Whalen. She is the CEO of our largest of our 3 state psychiatric hospitals, so she is responsible for running Central Regional Hospital in Butner. The other thing I'd like to share or remind is that it was back in February of 2023 when we provided, I think it was our last update on staffing, where we were with vacancies and turnover rates, and you'll see some references to where things have indeed improved, where perhaps some things haven't changed a whole lot, or maybe have gotten just a bit worse, but there is some hope on the horizon. A final reminder that under the Division of State-Operated Healthcare Facilities, we run 13 different facilities, 3 of which are psychiatric hospitals. We have 3 nursing homes that primarily serve individuals with neuromedical needs. We have 2 alcohol drug treatment centers. We have 3 facilities that serve individuals with developmental, with intellectual and developmental disabilities. We have a psychiatric residential treatment facility, and rounding out the 13 is that we have a weekday residential program called the Wright School in Durham that serves children school age with behavioral health issues. But what I thought I would do for the sake of this presentation and with Ms. Whalen's presence is to sort of focus in specifically on our 3 psychiatric hospitals, largely because the recruitment, retention challenges that we see in our 3 hospitals really are repeated over and over again in all of the facilities. So I think that even though while I'm focusing in on one setting of care, it really is very much applicable to all of our facilities. And the first slide I want to share with you is this one. And this is something I believe that you all know well, is that when you are running a state facility, it is a very different from your sort of run-of-the-mill Monday through Friday, 8 to 5 state agency. What Robin Whalen and her team and all of our other facility directors have the responsibility of doing is something quite different, which is ensuring that you have a wide array of staff to meet the needs of the patients that you are serving. They also have the added challenge of having to ensure that certain staff are there 3 shifts every day of the week, of every month, 365 days a year, whether it is inclement weather, whether it is snowing, whether we are facing a hurricane or other sort of elements. That is her responsibility. So what you'll see sort of surrounding this sort of fictitious patient are the kinds of skills and individuals that are needed to run a psychiatric hospital, certainly beginning with registered nurses at 12 o'clock, moving down through pharmacists and laboratorians and individuals that assist with taking x-rays, into social workers and psychologists, moving up to medical doctors and dentists, psychiatrists. The real the folks who provide the vast majority of the care and are the vast majority of the folks that we employ are the healthcare techs, the nurse aides in these facilities. You'll also note some of them have a little time clock beside their title. And that is because these particular areas have to have a presence 24 hours a day, 7 days a week. So, how are things in the facility? Well, and again, focusing just on our 3 psychiatric hospitals, Broughton, Central Regional in Butner, Cherry Hospital over in Goldsboro, we've shared with you the vacancy rate, not only the percentage, but the number of vacant staff, as well as the turnover rate. And the turnover rate is defined as individuals who come to work for the hospital but leave within 12 months. The good news on the turnover rate is that while you'll see the rates at 46%, 31%, 30%, as a whole, this is lower than the rate that we were seeing when we were before you on this topic back in February of 2023. The vacancy rate, again, you see it for each of the three hospitals. It was 30% on average across all three settings a year ago. So it has, perhaps at least for two hospitals, gotten a little worse, but it has certainly improved for Cherry Hospital. But even so, there are a lot of vacant positions in these facilities. And what that has required is that, again, Robin Whalen and her other fellow hospital CEOs have to rely heavily on professional temp agencies to fill in the gaps, particularly for those highly skilled individuals such as nurses and physicians, but also in trying to fill some of the critical certified nursing assistant positions. And as a whole, roughly half of our vacant positions right now are covered by temps. To Representative Blackwell's point, and I think this will illustrate this quite clearly, if you ask, okay, with that kind of vacancy rate, that kind of dependence on temps, what does that mean for your ability to serve or fill all of your beds in the respective hospitals? You'll see, again, here, the three psychiatric hospitals listed. The first column is the sort of maximum number of beds that they could have open at any given time, and totaling about 894 beds across the three settings. But because we have such a high vacancy rate and reliance upon temps, we are not able to staff all of those beds. And then you'll see the sort of math from maximum number of beds that are staffed or open, and so what is the number of unstaffed beds? And it's roughly about 100 beds in each of the three hospitals. They come in just shy at 296. What is interesting to note is that right now, the most recent data we have on individuals, both adults and children, who are waiting for placement, so they have been screened as needing inpatient psychiatric care, totals 225. Now that is an improvement from a year ago when that number was actually a little north of 250. But if we had the ability to fully staff and open all of the unstaffed beds, that final column, we could eliminate the waiting list across the state. And the final point, and then I'm happy to open up for questions either for me or Ms. Whalen, is that certainly some of your recent initiatives, our initiatives, things that we have done collectively have been helping, but we are not there yet and not out of the woods. The legislative increases have certainly been appreciated. The sign-on bonuses and more recently the retention bonuses that you use some of the ARPA funds to give to the facilities to then pass on to staff, I think is probably one of the things that have certainly helped improved our turnover rate, and with it going down over the last year, and certainly the labor market adjustment reserves where we have been able to target the salaries of nurses, most recently the salaries of our healthcare techs and nurse aides who form the backbone of our hospitals. And so some of the early signs of success that I hope that you hear from me and you may hear from Ms. Whalen is that we actually are beginning to see increases in applicants. When I was chatting with Ms. Whalen as we were preparing for this presentation, she was sharing with me that, we are seeing more applicants, which is a good thing, but she still struggles with, on average, of losing 3 to 4 registered nurses every month, and only has the ability to sort of hire one back. And again, that applicant pool is not quite as robust as we want it to be. And again, just wanting to highlight the slight decline in our turnover rate, which is welcomed. So we're left with still challenges around competitive pay. We are not seeking nor asking that we match dollar for perhaps what Duke Hospital may pay one of their nurses or physicians and other staff, but we very much need to be in the ballpark. And where we are is in one of the outlying parking lots right now, just to use an analogy. And again, we rely heavily upon licensed staff through our private temp agencies. That is a benefit. It allows us to serve who we are currently serving, but it does come at an increased price. And of course, not surprising, staff who are picking up extra shifts and staying late are experiencing, understandably, burnout. And so with that, Mr. Chairman, that concludes my remarks. Happy to take any questions from you or the committee, and certainly, again, want to draw your attention to Ms. Whalen's presence here, who can share with you real-time her role, her challenges running our largest state psychiatric hospital.
Thank you. Senator Bergen and Senator Heiss, you'll be next.
Thank you, Mr. Chairman. And if you've not been to Central Hospital, you need to go. I've been up there a couple of times, and Ms. Whalen, it's great to see you. Thank you for everything you do. It's a beautiful, clean facility that you feel like you're walking in, and it is a major hospital. So, thank you, Ms. Whalen. Can I direct a question to you, please, Mr. Chair? What 3 things, if you had the power to change, would you change so that you could staff and open all of your beds?
Robin Whalen, you're recognized.
Thank you. Wonderful to see you. Thank you for the amazing question, for the opportunity to be here. Our goal is to open all of our beds. That is what we're here for. That is why I joined, mental health, is to serve our state. And it breaks our hearts every day to have these beds closed and to see the waiting lists that we have. But in order to provide safe, quality care, I have to have a robust staff to provide that safe care. And you saw the number of staff that have to be there 24/7. And so for us to be able to offer that care, I have to have the staffing present. And our agency staff are amazing. I'm grateful for them, but they're agency, they're temporary, they're not invested. So you can't go over a certain percentage of your staffing to be agency. You need it to be more permanent. So the 3 things that I would say that we desperately need is to raise our salaries for those staff members who are here 24/7. The labor market adjustment rates were wonderful for us this year. They just went into effect, and I've already seen for our healthcare technicians, we went from an average of maybe hiring 2 a month last year in 2023 to over 20 in the past 2 months. It's had that big of an effect. But for my registered nurses, it has been very difficult. Our salaries are ranging around $64,000, and for an agency, they can make over $110,000. And so not really a choice there for some folks when they're trying to make those decisions. And I'm in an area with a lot of amazing organizations and healthcare facilities who also make significantly more and have additional benefits. So we've looked at it, and we've tried to raise our beginning salaries to $64,000, but I'm not getting anyone in there. And looking at comparisons, again, I'm not going to be a Duke, I'm not going to be at a UNC, but I'm thinking like if we got to $70,000, we could make a good starting salary and raise our midpoints. But that will take some funding for that. The second thing I would say is we need assistance with, our hiring practices to make them much smoother, less rules around it, so that I can hire someone truly on the spot and be able to offer them a competitive salary and a true, road in order to improve their career status throughout with the state. I remember when I started with the state, I was so proud. I still am every single day, and I want us to be a preferred employer. So I think we need a campaign around that and have an HR system that supports that to recruit people that want to make a difference in people's lives. And I'd say the third thing would be to truly have better partnerships with the community so that when I do bring in patients, there is a place for them to go once they're stabilized. A lot of the things that, Director Crosby talked about are amazing. We need that next step down level of care because once the amazing folks I have at my hospital do a great job, we're a teaching facility, and once our patients become stabilized, it's often difficult to find those placements. And so by that, our beds are staying filled and unable to bring in new patients. So those would be 3 things, but I'd say the biggest one is I need the staff to come in first, so to be a preferred employer that pays competitive pay.
Senator Bergen, follow up.
Yes, sir. Thank you, Mr. Chairman. Could we look at, and I guess this is for you, Chief Deputy Benton, could we look just at Central and do an analysis of of the total dollars that we're spending for all services that are outside, the different temps, the different agencies, I think we're spending the money. I just think we're spending it wrongly. And can we just take that one facility, do a deep dive, and I'll be happy to help on any of it, to dig into it, look at what we're spending, how we're spending it, and let's give her the tools to be able to do this. And if we fix one, maybe we can figure out how to fix the others too. So would that be possible, sir?
Mr. Chairman, Senator Mark Benton, Health and Human Services, very happy to do that. And actually, it's stated that we should pull together for all 3 hospitals, and will.
Senator Heiss.
Thank you, Mr. Chairman. I'm trying to get my head around this concept, and it's, if we could get salaries up, those kind of things. But nursing shortage is bigger than the state's salary issue. If we put a huge increase and made them competitively with Duke and UNC tomorrow, probably no one would be surprised that Duke and UNC would respond coming in, and we would find ourselves with the same delta that exists, because that's the workforce. But if I brought in any of my local hospitals, any of my others, they would all tell you the exact same thing. Like, they cannot find a nursing workforce. I can show you hospitals that have wings that aren't functioning right now because they don't have staff to kind of operate them. And so it's got to be more than we could bring a salary up that's what coming in. Other things I hear, and I guess to get you to respond to, at least historically, and maybe we've got it all fixed out right now, but the amount of time from when you post a position till someone starts work is inconsistent with a modern workforce. You go to any hospital, the one difference is you can start tomorrow. That's what coming in. They may have to work you somewhere while your credentials get done, depending on what level you're providing. But we're going to have a couple panels to come interview you and whatever else, and wait for the position to close, and 12 other things that we're going to have to go through. And I struggle with this private staffing concept too. We are creating our own problems. When you are putting someone on the floor and paying them more for doing the job than your employees are doing, I understand the emergency situation you're in, but there's no way out till you cut it off. Because if you're a new nurse coming out, which path do you think you're going? You can go work for the staffing agency and make more for the same job than you can working for the facility, and have more control over your hours and your process of those kind of things. And then finally, I think, I'd ask questions like, is every facility we got fully staffed with clinical staffing for nursing programs? Do we have nursing students in every area so that our community colleges are putting out and our universities are putting out the maximum number of graduates that they can? And how are we opening that process up? But I think all that to say is that the solution to this can't just be we're going to get our salary competitive, because even from our point, the next time we can raise salary will be next year, and we'll see the private facilities do it in a week and respond. But I just wanted to see if they respond.
Representative Blackwell, I've been disappointed since this is in your district if you didn't have a question. Thank you, sir.
You're the last person I want to disappoint.
I know.
Probably I'm piggybacking off what Senator Heiss has just said. I remember the slide that I think Ms. Crosby, but maybe it was Ms. Ford, put up, showing a graph of what was being paid to a staffer and somebody at Target. But as Senator Heiss, I think, has observed, we don't live in a static economic situation. We're always going to be chasing whoever is paying the greater rate. I was told not long ago by the folks at Broughton that they're losing people to the locally run UNC hospital in Morganton. And I remember reading in the newspaper, to go back to Senator Heiss's point about the shortage of just people generally, that the largest number of employees vacant in the county were at that hospital that's taking the nurses away from Broughton. And of course, the health department at home for the county says they're losing people to Broughton. So everybody's chasing after too few people, and it seems to me that rather than just this, that what we need from the department is some fresh thinking that combines what specifically do we need to do about these regulations that prevent you from hiring when the need is there and you've got a person standing there in front of you, and how do we deal with this salary issue that is ongoing? How do we use the dollars that we're paying temps now to maybe solve some of the salary needs? And I'm curious, too, as we create more partnerships to deliver the services elsewhere, do we have some thought that they don't have the staffing problem, that they can solve it and we can't? Because otherwise we're just creating more infrastructure and still don't have the staff for them. That really wasn't a question. I apologize.
Okay, that was a statement, but it was a good one. Thank you. Representative Cunningham, you're recognized, ma'am.
Thank you, Mr. Chair. Secretary Benton, has the full implementation of the electronic records, is that completed?
Secretary Benton, you're recognized.
Thank you, Mr. Chairman. Representative Cunningham, we have begun the process of implementing the electronic health record. We've selected the vendor. It will be Epic. It will be across all of the settings. Our hope, if we stay on track, is to have the first modules up and running in all of the settings at the end of this calendar year.
Thank you, Mr. Chair, just one last one.
Yes, ma'am.
Have we looked at transitional housing for stabilized clients that are leaving the state facilities?
Director Crosby, you're recognized.
Kelly Crosby, Director of the Division of Mental Health, Developmental Disability Substance Use Services. Thank you for that, Representative Cunningham. I can't tell you a solution right now, but with our crisis dollars and our justice dollars, we are looking at opportunities to support transitional housing. We know that's really important for getting people to step down out of state facilities, but also to step out of jail and prison. We just don't have enough. We're just trying to be thoughtful. We're looking at places that work, because I'm a mental health person, not a housing person, so I need to talk to experts in communities where it is working well so we fund the right things. But yes, we are absolutely looking at that.
Thank you. If no other questions, Deputy Secretary Benton, you can take us to the bar and make sure we don't all get poisoned by the final modular.
Thank you, Mr. Chairman. This is our final presentation, and as you have teed it up very well, this is providing the committee with an update on bar inspections, and it's more specific to bars that serve certain food, like I think about eggs, seafood, meat and poultry that is either uncooked and then prepared and sold for the public. As I brought a subject matter expert for the previous presentation about our state facilities, I have a subject matter expert here with me who's sitting next to Ms. Whalen. And you may know him well. His name is Larry Michael. He's our State Environmental Health Director. And so as I begin my remarks, just a couple of overarching points is that not all bars were impacted by the change in legislation in 2023, and that our overriding approach to helping folks come into compliance was certainly never to shut down a business or curtail their revenue, but it was really just to ensure that certain food that requires time and temperature control is appropriately handled and processed so the public doesn't get sick. And that finally, again, that we are not talking about sort of prepackaged food such as bags of pretzels or potato chips. We're not talking about garnishes, fruit garnishes for a drink. It really is specific to food that requires special handling. And so, as a reminder, or sort of perhaps a little bit of context setting, that across North Carolina there are 39,000, just to repeat, 39,000 food establishments that also handle certain food, again, thinking about eggs, seafood, raw meat, poultry, that requires special handling. They all adhere to the National Food Code that is developed by the U.S. Department or the U.S. Food and Drug Administration, and this is the same food code that we use and is used in all other states. The next slide, which you probably have already read, sort of lays out some of the reasons why the food code is incredibly important. Again, it comes back to ensuring the health and safety of the public. And why is proper food handling, proper hygiene of restaurant or folks who are dealing with food, why is that important? That is because 1 out of 6 Americans every year get sick from contaminated food or beverages. And sadly, 3,000 individuals lose their lives every year because of a foodborne illness. Largely, these individuals are infants or an individual perhaps with a compromised immune system. The next slide just provided you just a bit of sort of the historical, sort of the statutes and regulations as when bars were subject to permitting by the local health department. There was a period of time they came out, but in 2023 they came back in. And to sort of provide a bit of context, not all bars are subject to the food permitting and inspection by the local health departments. A bar that only uses food or fruit as a garnish is exempt, as are bars that only that do not prepare or serve food for charging to the public. They too are excluded. A bar that may only make available for sale to the public prepackaged food and food that the customer opens. So it's been prepared and packaged and the customer opens it in the bar, those bars are excluded. And finally, bars that are designated as a private club. So again, it's a smaller number of bars that are, again, serving food that requires time and temperature control, again, thinking about meat, poultry, seafood. And again, they are being held to the same sort of food regulations, the same food code as small and pop restaurants and other 39,000 food establishments across the state. You may have heard from perhaps a constituent or two who is now having to come back into compliance or initially come into compliance. And where we have found is some of the basic requirements that are required by the National Food Code are fairly straightforward. And I think most folks would understand why they are needed, and one being like a sink for hand washing. The food code requires that you have an area that is dedicated to storing food and food supplies. Also increasingly important to the food code is the ability to properly wash pots and pans, plates and utensils that again are being used by the public who is purchasing the food that is being prepared. And there are also requirements specific to certain equipment, but much of that depends upon the actual food or the menu and the food process being used. The latest data on bars that are having to come into compliance is that thus far we have 84 that have been fully permitted. Another 144 bars are currently in the review process, and we estimate sort of a combination of those two numbers, or perhaps even fewer, have not yet begun and still have a bit of work to do. Some of the concerns that we have heard, and again, given that there are 39,000 food establishments across the state that are permitted and subject to regular inspection, our local health departments have a lot of experience in this area and are ready and willing and able to reach out and provide consultation to any bars that find themselves in this category. But what we have heard from many is that they're concerned about the lack of time to actually make the required improvements. And as you may know, that we have extended the period of time to give them a bit more runway to come into compliance. Some are concerned around, do they have the adequate equipment? And again, we are providing assistance locally to help them with their food choices, which sometimes drive them to a particular piece of equipment or not. Some have expressed a lack of funding, and others have also talked about a lack of available space to actually continue serving the food that they are currently providing to the public for sale. Just to give you a quick rundown on this slide, these are the efforts that we have undertaken to assist those that have been impacted by the legislation and to educate them. And again, some of the efforts that we have done, and again, those that we have worked with. And that, Mr. Chairman, is just a very quick overview of our work in this particular area for the small number of bars, but happy to take any questions, and also, again, happy to defer a question, particularly one that may be more detail-oriented, to our State Environmental Health Director.
Thank you for that. I'm sure most of us have received calls on that from our local elected officials. Are there any questions from my friends on the Senate side? Y'all haven't been to the bar lately to get anything? I know my friends on the House side don't go to any bars, particularly Representative Lou. Any other questions? Thank you, for each of you, for coming and for your presentation and for your enthusiasm and your knowledge and wisdom. We appreciate it. And with that, this meeting's adjourned.